we can actually plead this. Now, I know that we've not had a few sessions in the past because of half term and stuff. So just I will briefly recap, what we've done so far. Now, because this is one of the important units that we study, especially as it relates to the health and social care. I think the main reason of studying international healthcare policy is that as a learner at the master's level, you should be able to understand, everything around how healthcare policy or a healthcare system works within a particular country. So one of the key things that we have to look at when you start doing the assignment for this unit is you have to pick a country. It could be your back home country, it could be UK. We have discussed the national, NHS in particular, the National Health Service, so that in this particular content, you have to contextualize it to understanding the healthcare policy and its context within a country. So you could look at the NHS, National Healthcare Service, or on the modal something which we have put across, for the Danish healthcare system. So whichever system you are comfortable with, we need to be able to understand how healthcare works within a country, what is and how are the policy and guidelines set, how these policies and guidelines then look at a bit of correlation with international agencies, and then to a certain extent what we need to understand is how the healthcare system and its delivery actually works within the context of a country. So we have to look at things like culture, the implication of culture, implication of society, the attitudes towards healthcare, and to a certain extent what we also understand is the social impacts which basically the healthcare policy can have on the people who make use of this system. Then towards the further learning outcomes that we studied, what we talked about was to understand how a healthcare policy can be translated into or developed into an action plan. How is the policy actually implemented? So in this context, what we've looked at is when we looked at the national healthcare system in UK, NHS, we looked at the NHS Act, we looked at the 2-3 various institutes like the National Institute of Promotion and Research, and we also looked at briefly the King's Fund, sorry, which basically looks at making us understand that how the NHS constitution actually works, and within the constitution, the NHS Act, the peace trusts, and how they all put together this delivery of services which are then utilized by various people and patients, in general the public within the UK. Now, to a certain extent, after that we studied what are the national and international impacts of healthcare policy on the UK healthcare system. So their coordination with the agencies like the World Healthcare Agency in particular, UNESCO in particular. So we briefly understood the joint working. In some cases, you have to look at when they're contributing budgets or doing programs jointly to help in development of R&D or research and development for new drugs, new systems to take care of patients, and also to a certain extent if there is a international catastrophe. For example, when we looked at international outbreak of any particular disease, for example, we looked at the Ebola, which happened in West Africa early last year, beginning of last year. We looked at a coordinated response from the international community to be able to look at helping the country out, and a lot of countries voluntarily contributed, medicine and budgets and other things to look at rolling out, some sort of a contingency plan to control the outbreak of that virus. And to a certain extent, what we have also looked at is what are the advantages and disadvantages of healthcare promotion. So all this healthcare as a system, as a means of service, is available to people within the country. But to a certain extent, when we look at certain issues like obesity, everybody is living longer, so this is leading to the creation of or diagnosis of new diseases, new types of conditions, and in those cases the NHS is trying to kind of promote the usage of healthy, living, which is looking at eating healthy food, balanced diet, working out. So there's a campaign that they run under Better Life, for example. When you look at breast cancer campaigns, you look at certain conditions in particular. When we look at some conditions which are affecting more and more people, then the national health system, or NHS in this case, takes care of reaching out to people, public in general, through the healthcare promotion route. And we looked at briefly in the presentation, promotion on breast cancer, certain types of cancer, which the NHS funds and does in conjunction with third-party agencies. And some of these promotions we get to see on mass advertising in terms of television, hoardings, and other bits. So we understood the role of how sometimes, in order to promote good health and also to promote healthy living, the healthcare system in a particular country also has to invest money into marketing to raise awareness through the route of promotions, so that it generally makes the patients and the people in the mass public aware of the advantages of healthy living and exercising and things like that, which in the long run reduces burden and costs on the system, so that people, one, are aware of the types of services they can get, and the second is, if they are aware of these conditions which can affect them at a later stage, prevention is better than cure, and the promotion aspect of it actually helps to get this message out there to the mass public and people in general, to make sure that the healthcare system functions effectively. Now, in the last outcome, what we are going to do is anything that we have not studied, in the context of international healthcare, the policy, the implementation, the development of the policy, and its availability of services to various aspects like GP surgeries, care clinics, hospitals, and trusts. What we are going to do is understand that in Learning Outcome 5, wherein what we look at is we understand what are the contemporary issues which are involved in healthcare. So when we look at contemporary issues which are basically, what do we classify as contemporary issues? Now, contemporary, if you look at just the meaning of the word contemporary, it means any particular event or occurrence which happens outside the norm. That means if I have to go to if I have to go and pick my kids up from school, the normal route that I take would be that I drive the car and obviously go to the school to pick them up, and that's a normal course that you take on a daily basis. But on certain occasions, because there's a traffic jam or there is some sort of an issue with the car, for example, if it's not it's at the garage, then what you tend to do is you would end up taking a bus or you would end up taking a taxi. Now that would become a contemporary route. That means you are deviating from the norm to be able to do that task. So contemporary issues are issues which are basically things, or it could be called as implications, or conditions which are normally not present at a given point in time, and you have to address them to be able to sort them out in the future. So when I say that this could happen in the future, now because that thing has not happened, and that is something that you cannot anticipate, that will become something called a contemporary issue. Now, in the case of healthcare, when we look at, now contemporary issues would look at referring to issues which are current or issues which are recurring again and again, and are basically situations which we have to deal on a daily basis, but for which we don't have a set procedure to deal with them. Is that okay? So this we need to understand from a point of view of looking at what are contemporary issues. So contemporary issues would be defined as any issues, and I put a definition here in the in the slide notes, are issues which have implications, applicability, relevance, and significant, and affect the material presence in any given time, and they have to be sorted in a particular fashion or in a particular time frame, would be classified as something called contemporary. So when we look at defining them, just to simplify its definition, the contemporary issues refer to current or occurring issues in healthcare sector, right? So when you look at some sort of bugs or viruses, when people are admitted in hospital, when you look at the norovirus or some sort of a virus which is now not being able to treat when we look at cleaning the wards and cleaning the beds, because that virus still leads to infections and the antibiotics have become resistant, the virus has become resistant to the antibiotic, they would be classified as something called contemporary issues, because we don't have a current solution for that, but we are trying to treat it with the same solutions or antibiotics or solutions that we have, and they then try and bring it under some sort of control, but they are not fully under control. So they will be called as contemporary issues. Is that okay? Now, these issues include issues which we face in hospital care standards. It could be elderly care, people who are living in the care homes, if they have issues in terms of standards that we are not able to provide, say, for example, clean beds, linen, and things like, for example, 3 meals or, some sort of facilities which are required in the elderly care homes, then would be classified as issues which are contemporary issues. Some of the issues, when we look at funding, related to funding, that means government is looking at austerity, they are cutting down on funds, or in general, they are moving funds which were applicable for, say, nursing homes or care homes, but they have now been moved to the hospital or care trust, would also be classified as contemporary issues, because budgeting in the healthcare system goes up and down depending on the availability of funds. To a certain extent, in certain cases, what we see is when there is no budget availability or no funds availability to have a budget, then it also becomes a contemporary issue. So what we are seeing is the Health Secretary, Jeremy Hunt, is trying to look at having GPs and surgeries open 7 days a week. But he's not able to have the surgeries work 7 days a week so that patients have access to their GPs because of one of the contemporary issues, which is budgeting. That means there is not enough budget available within the NHS to open surgeries on the weekends. Correct? So funding in this case becomes a contemporary issue. That means it's an everlasting issue. That means it's an issue which is lingering on and on and on. And because there is no set specific solution for it, that is why we classify it as a contemporary issue. Okay. Now, in order to study contemporary issues, what we need to be able to do is we need to look at borrowing from what we've learned in Learning Outcome 4, things like the role of promotion, media, and the reliability and validity of information. Now, there are lots of things which, for example, President Donald Trump has said that this is fake news, that is fake news, right? The reason why he talks about it is that because there is no sanctity in terms of reliability and validity of that information, he terms it as fake news. So similarly, when we look at issues, there are lots of issues which we think of within the healthcare system are problems essentially. And those problems are classified as issues. But how do we differentiate them? How do we differentiate these problems from something which is a genuine problem, from something which is a non-genuine problem, or a problem which has been created or is being perceived as a problem, but it is actually not a problem? So what we have to do is, to understand them, we have to basically segregate these into certain categories, and these categories have to then have reliability, can only be considered reliable if we have a data kind of backing that issue. Now, if we say, and most of the things that we get to hear from our GP surgeries is that we don't get enough funds, that's why they don't prescribe, say, for example, antibiotics, or they don't have surgeries open over the weekend. Now, what's the data behind it? The data that is required to classify that as an issue would be the number of appointments which are happening on a daily basis, how many patients is the GP seeing, what is the ratio of the patients to the GP. That means in a surgery, if there are 5,000 patients registered and there are only 10 GPs, that means the ratio of patient to GP is about 1:500. Correct? Now, if sometimes you have to see the GP, that means if in this case, if one GP is responsible for 500 patients, then if they have to seek an appointment, then in those cases, you would see that if he sees about 10 patients a day, that means a repeat appointment for that patient will come typically after 50 days or about 8 to 9 weeks. And is this an issue? It can be treated as an issue provided there is enough data to justify that this is the case, and that yes, that would mean that if the patient has to see the GP again, his appointment would come after typically so many days. So in order to back it up, we have to look at the information which is available and the validity of that information which is available, so that we can clearly classify it as a problem or an issue, and that would then be classified as an ongoing issue or a contemporary issue. Now, what are the contemporary issues in healthcare management when we look at? We look at issues which are classified here. So there are issues which are strategic, financial, human resource-led, operational. There are issues which are related to reforms, and there are issues related to the quality of care being delivered. These are the 6 different categories that we can classify issues into when we look at contemporary issues in healthcare. Okay. So an example of this would be if there are lots of patients in a GP surgery and there is no online booking system for taking appointments, then this is an operational issue. That means if the lines open at 8:30 in the morning and they close at 9 o'clock and all the appointments are gone for the day, that means people keep trying and they get a busy tone. But because they are not able to reach the reception, they might have been trying, but in the queue, but all the appointments have gone for that day. So this turns out to be what is a operational issue. That means the GP surgery should implement an online appointment system. That means the customers or their patients registered with the surgery can actually go online and take the appointment without having to wait in a queue on the phone to be able to take or confirm appointments. So this as an issue, if complaints start to come in that, okay, I am not able to get an appointment, I keep calling on the phone, but they're always busy, that means that becomes an operational issue and it can be sorted provided they have something which is like an online appointment booking system. Okay. Now, when we look at other issues, for example, sometimes we see that there are issues related to, financial issues. Financial issues would be that you've had an operation at the hospital and the operation has not gone well and it has led to complications. So the patient decides to sue the hospital or the authorities to get compensation, and that could become a financial issue. So there are news, I don't know whether you see, but there are lots of pieces of news which are coming, from time to time, that there are lots of these lawyers which actually fleece NHS of so much funds because of wrong cases and wrongdoings. And I think it was a headline news, I think 2 or 3 weeks back, wherein there was a figure of 460 million, which was said that there are greedy lawyers which make false cases, and NHS is being, kind of fleeced for this money because of this, financial, litigation system happening within the NHS. Right. So some of these contemporary issues we can look at examples of, and these then can be looked at issues which are, because they are issues which are backed up by data and issues which are backed up by information and it is reliable. That is why we classify them as contemporary issues. One of the strategic issues could be, there is an issue which now we know in NHS that NHS is starved of funds. That means there is not adequate funding to fund all the services which the National Health Service needs to provide. Now, this is a strategic issue because the government is looking into ways of bolstering the budget for NHS. They announced last year in the budget that, with the Brexit happening, that would free up extra 2 billion, which could be invested into NHS as a budget to, make funds available for frontline services like A&E department in particular. Now, because this is an ongoing issue and budgeting is always an issue with NHS in terms of the funds, whatever government gives is less. They are also starting off something which is the system of, savings or cost savings within the NHS to do away with expensive contracts, which is providing, profitability to private companies as against providing services, and there are other options available. So this then becomes finance, and when we look at cost cutting and budgeting as an issue, is more of a strategic issue because it is long term and it affects everybody in the long term in terms of NHS not being able to fund its services or fund its services to provide these things to the public in general. Okay. Now, one of the things we also look at is sometimes you see a lot of things being talked about in the news, but that does not mean that it is related to the National Health Service, or that issue is directly related or contributing to becoming a problem as far as providing these services. So what we look at is in this particular context, we also study the role of media. What is the role of news? The role of news is they kind of are significant because they are the ones which capture the news and then present it to the people in terms of happenings or events which are relevant to the National Health Service. So the media has a role to play in this whole what you call aspect, is because they need to be able to inform people about what the National Health Service is providing and in what the National Health Service is not providing, where they are suffering and because of which the services are suffering. So when we look at the role of media, they look at things like if there's an outbreak of virus or if there's an outbreak of any epidemic, then the media is the first one to be able to communicate to mass public that this has happened, that has happened, and you need to take these precautions. So it plays a very important role in dissemination of information to the mass public when certain outbreaks happen. Let's look at the role of media. There is recently something which NHS was affected with. Can you recall what the NHS or most of the hospitals in West Midlands, Yorkshire were affected with, in England in particular, a couple of weeks back?
Sorry?
Most of the hospitals in West Yorkshire, Midlands and England were affected a couple of weeks back by a particular outbreak. Can you think of why they were in the news?
No, I didn't.
Right. Okay. No worries. I'll mention this to you, and I think you'll be able to relate to that. There was a cyber attack on some of the hospitals in the last few weeks, and because of which a lot of operations and a lot of procedures had to be delayed or postponed, because a lot of operational equipment in the clinical equipment in the hospitals was not, was under attack by cyber, terrorists, or there was a hacking involved in the hospitals. Do you recall this news? I don't know whether you recall this news or not, but this was national news. Cyber hacks for England hospitals. This was major news, because I think there were some about 80, 90 hospitals or some 200 odd GP surgeries which were attacked by they faced a cyber attack, and because of which they had to postpone operations and procedures and basic things which were happening in those hospitals. So if you see, this was the big news: NHS cyber attack, large scale hacks plunges hospitals into chaos. So this was something in the news, in the month of May, June in particular. Hello. So we also had, these attacks happening in Scotland in particular. So the role of media, when we look at, is important, is because of the fact that they have a role to play in informing people about the status of affairs in the health and social care sector. And sometimes they are able to communicate news or basically share information in the form of breaking news in terms of outbreaks of diseases like the Ebola virus, which we spoke about a couple of minutes back, and also in the case of some new treatments or drugs which are brought in or introduced by NHS and NHS related contractors. So the media has a very important role because they also play. They have an important role in also influencing the attitudes and behavior of the people in context to the health and social care sector and the role of NHS and the services it provides within the particular system. So they also hold, to a certain extent, the public services to account under the Freedom of Information Act, if you've heard, which was introduced in 2010. They can actually seek out information from the NHS Act, and the healthcare department in particular, within the government healthcare department, to bring out pieces of information which then can be shared with public in general. So there is a very important role which media plays in particular when we look at, at the healthcare system. One of the key things that you will need to remember is obviously the Healthcare Act, the Freedom of Information Act. The Freedom of Information Act allows the media to be able to pull out information and share that in the public domain under this act, which was introduced in 2010. And this act then allows the media to seek information from public services, public departments, the healthcare department in general, to be able to get information on the services being provided, the budgets being allocated, the spending happening, and then share that with public. And because they are able to get access to this information, from various sources, this information can be validated and it is reliable. And the dissemination of this information happening, by the media under the Freedom of Information Act is then information that which can be shared accurately and reliably with the public in general.
Okay.
Now, the other bits that we look at is how we look at understanding what is the impact of the healthcare policy on some of the international issues. Now, when we look at the policy which has been developed by NHS or by UK government in particular under the NHS, what we do get to see is that they have looked at creation of this policy by looking at things which can affect the services which NHS provides. Now, to give you an example, what I would basically say is that if there's an outbreak of a particular, disease, for example, if there's an outbreak of, say, for example, because there are excessive rains which happen during the winter months, accumulation of water, in some places can lead to, creation of let's put it this way, the mosquito, or it can lead to fever, dengue fever, and it leads to high risk in the case when it is detected, and the larvae can actually survive even after the water is dried up, but it can lead to obviously wide scale spreading of, say, dengue, which is a kind of a fever, or a malaria kind of a fever, which is let's put it this way, it is spread by mosquitoes. Now, this happens in developing countries. Now, somebody coming into the UK, say, for example, if you've gone on a holiday and you've got affected by this condition, but you could then bring this back into the UK because you're traveling back to the home country and you would want to receive treatment here in the UK as against, for this when you were out on a holiday. So because you're able to bring this back as a disease or as a symptom when you're traveling back, in those cases, what the system has to do is it has to create provisions for treatment, which is for diseases or for example, in this case, issues which are not particularly present in the UK but are present outside the UK. So an example that I wanted to quote here was that if you're traveling abroad on a holiday and you get affected by, say, dengue, then you are at high risk in terms of, because you run high fever and other bits and pieces. And this bit can also be transmitted when you travel back to the UK. So here, what the provisions which the healthcare policy does is it creates a system wherein certain types of conditions which can be brought in or imported from outside the UK by its own people can then be treated safely within when you arrive back into UK. So I've gone on a holiday outside, I've got affected by mosquito bites, and I've developed dengue fever, but I don't want to get treatment done in, say, for example, my holiday destination. I decide to travel back, but I'm traveling back with the same condition. And what happens is when I go into the GP surgery, they say, okay, you've developed this, but because if we had not created treatment or not created provision for this treatment, because it is not a disease generally prevalent in the UK, but in emerging countries, then there was no way that the person could have received treatment in the UK. So when you look at policy creation, sometimes the governments have to look at inclusion or creation of provision for such diseases to be treated within their geography, even if they are not being diagnosed or is something which they cannot be affected with, but they have to have provisions for it. Is that something which is clear?
Yeah.
So a simple example of that would be that, for example, I For example, in my case, let's put it this way: you look at obesity. The reverse side of it is you look at obesity, smoking, alcoholism. These are now problems which we are facing in developed countries, but these are also problems in developing countries, right?
Eat as well.
Yeah. So even if you look at increasing westernization, which is happening in developing countries, what we do get to see is that a lot of people are now smoking. A lot of people have access, and they have, because of the living standards, they're able to smoke and they are able to have alcohol or expensive liquor, which is leading to conditions which are generally seen within developed countries. You know, so in our if I look at countries like emerging markets like African countries, India, China, you look at countries like India, wherein people normally would spend money on buying food and other basic things rather than spending money on alcohol or smoking, because they do not earn enough to be able to kind of afford these luxuries. So if they develop a condition like serious liver failure or severe bronchitis in lungs because of smoking, these are things that we get to see in developed countries, wherein the economic levels are quite high, and people have easy access to these kind of things. So what I'm trying to say here is, sometimes when the healthcare policy is made, even if it's being made by a country which is not very advanced, they have to look at making provisions for those diseases or conditions which are not prevalent in the country in a large scale. So if I have to go to a country like India, for example, there alcohol, a lot of people do not consume alcohol because it is it's considered not safe in their religion. It is not prescribed. But because of increasing westernization, what is happening now is a lot of younger generation or the modern generation is now drinking a lot of alcohol. And because their systems have been such that they have not created provisions for treating alcohol conditions, that means that in this case, what they want to be able to do now is increase or include a policy and bring it into their policy framework to have people being treated for alcohol or conditions related to alcohol. So sometimes when you look at provision of healthcare and creation of healthcare policy, what you look at is that you have to sometimes look at including context of diseases or symptoms or problems which are not generally applicable to your country, but because they can be exported from other countries over a point in time, you have to have provisions for them to be taken care of, or provide solutions or for it. Okay. Now let's look at, when we have talked about a lot of issues, contemporary issues. Let's look at what are the top 5 healthcare issues identified by a website called Health Watch. Now Health Watch is a network which basically looks at creating a database of issues within the UK, and they talk about the top 5, top 10 issues which are going to be affecting us in the future. What they've done is they have a network of say agencies through which they collect data, and they do surveys to be able to identify what are the top 5 or top 10 issues that the sector could face going forward. Now, one of the key things that we are looking at is, because we are living longer and the life expectancy in general is increasing, we see a lot of mental health services issues now cropping up. Things like dementia, Alzheimer's disease. These are issues which are cropping up because of the westernization style of lifestyle, and also because we are living longer. So access to and quality of mental health care services is being raised as one of the biggest issues which NHS now needs to address, because as people live longer and these new types of disorders, diseases which are being diagnosed require a creation of a mental health services division within the NHS to provide services and to take care of patients. Okay. The second issue which they talk about is primary care issue, which is related to primary care services, and we talk about the access to GPs and dentists here. That means most surgeries, most hospitals have an issue in terms of staffing. That means they are not able to have enough qualified staff who are able to work within this sector. And because they do not have qualified staff, it puts pressure on the existing people working, and this is exerting pressure on them to be able to provide services, but this is leading to compromise. So when we talk about the things like, what we talk about the things like, for example, GP surgeries, when Jerryman wants to open them for 7 days a week, but what they say is, because if we have to open on the weekends, we have GPs who will have to do locums, and for locums or locum GPs, they'll have to pay fees and services. Now, because there is not ample budgeting available, this becomes an issue because you're not able to open surgeries over the weekend. But because you're not able to open surgeries over the weekend, that means access to GPs in general for patients registered with that surgery is decreasing. So if you have to seek an appointment, in some cases you get appointments after a month or after 4 to 6 weeks, and this then becomes one of the clear issue, which is a primary care issue. That means if you have a problem and you have a symptom, who do you go to first? You go to your surgery, isn't it? You don't go to the
GP.
you go to GP. So what is happening is, because people are not able to get appointments with GP surgeries, they are going into A&E, and this is putting a reverse pressure on A&E departments to be able to deal with patients which actually should be dealt with surgeries in the first hand. So primary care services, in terms of services to be made available from GP, surgeries, care homes, are the second most important and the third most important issues which they've identified. Now, other issues which they've identified, the number 4 and 5, are services working better together. That means the system has become so big, it has become so fragmented, that what is now happening is that if you are faced with a particular problem, you go to the surgery refers you to the hospital, you go to a hospital, they refer to a consultant, you go to a consultant, they say, okay, you have a 4 to 6 weeks wait time and you have to get this procedure done in such and such place. So services are not being, these hospitals or these setups which have been created are not able to provide services in a unison manner, but they are being fragmented because the system has become too big, and because of the scale of the operation, sometimes we do get to see that they are not able to work together to be able to provide that service to the patient or to the people availing that service. So in some cases, getting hold of quality service is becoming an issue, right? And this is an issue, for example, if you've been diagnosed with, say, for example, a blockage, and you have been diagnosed with a blockage. So what you do is your GP surgery recommends you go to the hospital and you see a cardiologist or a consultant. The cardiologist will do a number of tests with you, like a stress test, an ECG, and then after that, what they would suggest is that you need to undergo a clinical procedure. But from that stage to undergoing a clinical procedure, there's a huge wait. And because the system has become too big, sometimes things are not available. What is happening is that the quality of services are suffering, and the patient is able to not see getting hold of this service through one particular banner, but they have been asked to go to different departments, different places to be able to get that procedure done. Now, we also see one of the issues which they've identified is hospital discharge. That means people are being discharged, are not being discharged at the right time, and are not being provided the right aftercare required once they are discharged after a clinical procedure or an operation. So hospital discharge is being done in some cases quite quickly, wherein the patient's care is suffering, and there is no post-care being provided for in certain cases when the patient has undergone some sort of a clinical procedure or an operation. Is that okay?
Yeah.
So these are some of the big issues which we've identified from a point of view of looking at issues which the healthcare system in general faces within the UK. Now let's look at some of the issues which could arise because of say Brexit vote. There is a lot of discussion that 55% or not 55%, about there are about 148,000 people or 150,000 people which are employed within this sector. Now 55,000 people of those 150,000 are basically, in terms of the workforce, is basically from the European Union. Now if UK is to exit without securing the rights of these citizens living in the UK and who work within the NHS or the work as a healthcare professional, HCP, then in those cases, what will happen is staffing in the NHS will become one of the biggest issues, isn't it? Yeah. So
Yeah.
as you, lots of nurses, there was a news that a lot of people are now leaving their jobs in the NHS and going back is because there is not yet an agreement between UK and the EU in securing the rights of people who are staying in the UK and have been traditionally, EU citizens. So once their rights are secured, then their jobs are secured, and obviously from that point of view, that that insecurity which a lot of people have, that what will happen because once the UK leaves the EU, what will happen is that my rights will not be no longer protected because I'm a European citizen. But in that case, I might be asked to leave, or I must be kind of made redundant from my job because I don't have a British nationality and things like that. So staffing is one of the issues which is being discussed in a great detail, specifically related to the healthcare sector, the financial services sector, because of London being the financial hub. And this is one of the biggest issues which the government has to solve in order for the EU nationals to be able to continue to work within the National Health Service. Okay, and because the people working within the NHS is quite high, that means they have to reach some sort of an agreement so that this does not become or remain an issue once UK has left the European Union. Okay. The other bit is when I don't know whether you noticed or seen that we have access to a facility called the EHIC card, European Health Insurance Card. Now, when we travel to holidays in Europe, what we can do is, because we have the EHIC card, if we are to fall ill or if we need to seek any treatment, then that means we can actually go into any particular GP surgery or a clinic in any location within the EU, and we can receive the basic treatment because we are a part and parcel of the European Union so far. And the EHIC card, which allows us to get access to medical facilities, allows this facility to be availed absolutely free of cost.
Okay.
Right? So if I'm traveling to France, for example, and I fall in and I need to get some medicine, I can go to any local surgery there and then show my European health insurance card, and that card allows me to receive a prescription and medicine absolutely free of cost.
Okay.
Because I'm a UK citizen, which is a part of EU at this moment. But when we leave and when Brexit happens, the government needs to negotiate the status of, if most of us travel to Europe for holidays, when we go on holidays, what will happen in that case? Do we need to take out private medical insurance? Will the hospitals and the clinics and the surgeries be able to see us if we need those services when I'm not well and things like that? That is something, again, which is a broader issue which they need to solve before we exit the European Union. Okay? Now, in some cases, when we look at one of the issues is regulation. Currently all the laws that we follow, the European Court of Justice can override any law or any such ruling within the UK or by UK Supreme Court. Now, when we leave the EU, what will happen is we'll need to develop some of our own regulations or revert back to some of the regulations which were there, law and legislation regulation which was there before we joined the European Union. So when we leave the EU, we will have to create our parallel laws to be able to deal with and have that regulation in place, right? One of the key that we study under this is that under the European law, what we say is the full-time working week is how many hours?
48?
No. No, it's not 48. The full-time working week is 37.5 hours.
37.5, yeah.
37.5, or say round figure 40 hours, because every week, if you have to work normal hours, the European Working Directive basically says that if you are considered working full-time, if you are working over 35 hours as per the Working Directive of European Union. Now, in the UK, when we say that you are working full-time, what we do mean by that is that we are working full-time means we are working 37.5 hours. But in the case of doctors, when we look at the working time regulations stipulate that they can on an average work up to 48 hours a week and nothing more, nothing less. And that is considered, the working time directive for GPs in particular. Okay. For us, my working full time means I'm working 37.5 hours and that is considered full time, or 40 hours, that is considered full time. But in the case of a GP, what we look at is that if they are working 48 hours, they can work this particular period. They have to work 48-hour weeks to be able to consider working full time. And beyond this, they will not be able to work because this puts a lot of stress and compromises the kind of services they provide if they work more than 48 hours. Similarly, the working time directive for pilots, people who fly aircrafts, is stipulated at 70 hours, if I am correct. I think working time directive for pilots,
70 hours.
I think is 70 hours or 150 hours a month. One second, let me just double check. So it's, no, it's 22 hours, right? 22 hours a week. So they cannot fly for more than 22 hours at a stretch under the working time directive. Now, these regulations have been put in place because they want them to understand that people under certain jobs have certain stresses. And for certain professions, any working hour more than this working hours would mean that they are providing compromised service, or it can lead to risks and it can lead to mitigation in terms of, not being able to provide right kind of services to their patients. So when you look at GPs, so GPs is 48 hours. When you look at pilots, it's 22 hours. So this regulation is the third issue. When we look at identifying it in a bit more detail, is that we have to look at coming out with something which relates to this once we leave the EU. So some cases we also look at this being an issue, but there is international coordination to understand that if you have certain people working in certain professions, that they should not be allowed to work beyond these hours, because beyond these hours, if they continue to provide service, then this can lead to compromise, or this could mean drop in the quality of service which these kind of people provide. So for GP or doctors, it is stipulated at 48 hours at a stretch they can work. Beyond that, they have to be given, a week off, and after that, they have to again do 48-hour shifts. Okay. Now, similar concept of when we look at, international coordinated effort on epidemics or problems which are going beyond the country. So Ebola virus was actually a catastrophe, or a developing condition which spread across to 4 different countries: Congo, Liberia, Western Nigeria, Western Ghana. So a couple of countries were affected, and that meant that one country's government could not, or one country's healthcare sector could not cope with that demand, and that required international effort to contain that particular epidemic. Like you look at Hurricane Katrina now, or the recent hurricane which has devastated a lot of places in the Caribbean. So you look at Cuba, Puerto Rico, a lot of other British overseas territories. That has meant that it needs international cooperation to be able to deal with that problem, isn't it? Those kind of things sometimes you look at when we look at dealing with these kind of issues in particular, and these are all kind of called contemporary issues, because the issues which sometimes require not just one country's healthcare system but some other international effort to be able to coordinate all this. Is that okay? So the other slides, basically cover, give you example of HIV, again, something which requires international coordination, and this is where sometimes some countries have to look at funding, creation of funds. We give a lot of overseas aids to be able to prevent some of the diseases or, problems happening in countries so that they cannot be exported back into the UK. And that is all under the context of contemporary issues in health and social care, both in the national as well as in the international context. Okay, so that brings us to the end of this particular unit. What I'm going to do is send you a copy of this presentation, and along with that, I will send you a copy of this handout, which is a 4-page handout which talks about contemporary issues which the ethnic minorities, which is Black, Asian minorities faced within the UK. So this is a extract report which talks about what are the contemporary issues which can be identified under the National Health Service or in general across the healthcare system. Slightly old in terms of, it's a report which was compiled in 2013. That talks about and gives you the overview of what we discussed in some more details in terms of why these are considered as contemporary issues in particular. Okay.
Yeah.
So I'm going to end